I'll start by saying it really is, this is my first visit to the MSA Coalition annual meeting. Arijit, Bhaumik, my project manager, is with me today, and we're both really floored and amazed and privileged to talk to everybody here, patients, families, survivors, the organizers for the meeting, the other neurologists and other health professionals here presenting. It's been fantastic. You know, I came here with the intention, one of them, of presenting what I have to share and giving you some information, but the reality is, you know, I'm going away back to Ann Arbor with a whole lot more information than I came here with. So you guys are all the best teachers out there, really. Okay. So I'm going to talk about PET imaging. And the first question is, how do we win a war? Right? We got to beat MSA here. How do we win a war? Well, in the physical world, the enemy is defeated by dropping missiles on them, maybe, taking them out, stopping their advance, finding their command and control center and destroying it. And we have a lot of fancy tools to do that in the physical world. Against disease, we want to develop similar tools. That's what many of us clamor for. Where are the weapons? We need the drugs that at least weaken the enemy here. Where are the procedures? Where are the, can we develop a stem cell that goes in there and replaces the damage and fights the disease that way? In the physical world, we win wars by gathering intelligence first and foremost. We have to know where the targets are. You look at a landscape and you know there's a bunker there, there's an airstrip there, there's a command post in this other place. We spy on them, we find out where stuff is, then we hit it. We need intelligence for disease as well. Desperately needed intelligence. A complex disease like MSA, we need it. You've seen variations of the first picture on your left there, which shows the landscape after MSA has been through it. You see brain cells, glia, neurons, abnormal balls of protein that contain alpha-synuclein. The patterns of what we see in these cells as the disease has swept through tells us something about the enemy. We learn every time we look at a brain from somebody with MSA. And we start to look at groups of people who've had this disease, and we understand patterns, we understand how the disease works, bit by bit, more by more. On the right is a PET scan picture. And this is a picture that looks at an actual molecular target in the brain. And we can actually take a picture of specific areas of the brain and how it uses sugar, or how does the dopamine work there. And we can try to find new targets. So the human brain is the most complicated thing in the known universe, and we can look at that and say, oh my gosh, that is daunting. That is tough terrain. And yeah, we have a lot better scans than we ever had before. MRIs weren't being used 30 years ago. We now have really fantastic pictures of the structure of the brain. But even an MRI isn't good enough. You can't look at an MRI and really see MSA. We can't look into an MRI and see exactly where the cells are dropping out, where the glia are being lost. You can see big picture changes like some atrophy here and there, but that only gives you the surface of what's happening there. So the MRIs are great, but we need something better. You can try to fight the enemy on a landscape that's dark and hilly, and you know they're out there. But we need intel. We now have night vision spy satellites that can tell you where the targets are. We need better ways of looking at things. We are there, we're getting there with brain imaging. We have on the left an MRI that shows you brain. You see tissue, you see frontal lobe, parietal lobe, brainstem. But we have our own versions of night vision goggles to peer into the brain and see what are the dopamine neurons doing? What are the serotonin neurons doing? And more this kind of technology is coming out there and helping us learn. So, just to recap, nerve cells talk to each other, neurons, and neuron A talks to neuron B via a synapse. And the synapse is the junction at which these little molecules called neurotransmitters jump across and say yes or no, as Dr. Chalimsky put it, when they're passing their votes. And they do it in a language. The language is the neurotransmitter. Some neurotransmitters use serotonin, some use dopamine, some use glutamate, some use norepinephrine. We can actually start to see now various neurotransmitters precisely while ignoring other ones. You guys have all heard of dopamine. Dopamine is an important neurotransmitter in allowing us to make our movements automatically with the right size without having to think about it. If the dopamine system doesn't work well, our movements get small, effortful, hesitant, and we can see what the dopamine's doing. So we now have tracers, PET imaging tracers, where we inject a small amount of a molecule that goes exactly to maybe the dopamine receptor. And this has a little bit of radioactivity in it. So it gets to the target of where the dopamine is, and it emits a little bit of radioactivity. And that spot in the brain lights up. And so we can see how much of that target is there. On the left is a normal scan looking at the striatum part of the brain. And you can see bright glowing structures shaped like ovals that show an intact dopaminergic system in that area. On the right, you can see the brain in somebody who's had multiple system atrophy, where you can see that the dopamine system there has degraded. You can look at MRIs side by side and they would look the same. So before I get into our specific research, I just wanted to make the point that there's a lot of research out there, a lot of centers out there trying to use the technology that we have to better understand the disease, gather more intel, find more targets for ultimately the weapons with which to defeat this disease. At the University of Michigan, we have a project where there are several questions we're trying to understand about the disease. There are nerves that go to the heart that help the heart pump faster or slower or adjust what happens when you're getting in front of an audience or just getting up out of bed. And what happens to these nerves that go to the heart in multiple system atrophy? We're not really sure. They may be affected. It was thought that actually those particular nerves were not. But if they are affected, does that somehow affect how people do? If we do find that these nerves are affected, are those people more likely to get a certain complication? If so, maybe they should be treated differently. What's happening with serotonin? So serotonin is another neurotransmitter that's important in regulation of sleep, regulation of mood, and even regulation of things like breathing. Is that a bigger problem? Acetylcholine is another brain chemical that is important with things like postural regulation, balancing dopamine, and thinking and memory, sharpness, problem solving. What's the acetylcholine system doing in MSA? We don't fully understand yet. Are there different types of MSA? Are these different systems affected in different ways in different people? Yeah, there's cerebellar and Parkinsonian, but maybe there's more to it. Maybe within these groups there are different types of people. And most importantly, we need to be able to figure out the changes, watch the changes as they're happening early on in people with disease, with people with early disease and learn from that so that we can try to ultimately cut the disease off early. So we need to see what's happening in people with early stage disease. So this is a picture of a person in a PET scan. And this is an example of what we're doing here. This is the brain, this is the spinal cord. If you cut the spinal cord in a slice and look on it on end, this one column here on the side has a number of cells in it. It's called the intermediolateral column that gets degraded in multiple system atrophy. Ultimately, those neurons go out and talk to another set of neurons that goes to the heart. We know the first set of neurons that start in the spinal cord gets degraded. We don't know about these neurons going to the heart. These neurons that go to the heart talk using norepinephrine. And we can actually take a picture of the heart nerves, of the norepinephrine nerves. This on the left is an example of normal functioning norepinephrine in the heart. On the right is a person for whom there is loss of those norepinephrine nerves to the heart. And we're just taking a picture of those nerves. You can't see it in a regular MRI of the heart or a CAT scan. We're studying that. The serotonin system. Serotonin is a neurotransmitter that ascends the brain and goes to the front part of your brain and helps you with anxiety and mood and sleep as well. But there's this other part of the serotonin system that's lower down in your brain that drops down to your spinal cord and gets serotonin down into your spinal cord and helps regulate breathing and blood pressure and other things. One interesting thing, this serotonin system they found out might be a problem in sudden infant death syndrome. So those of you who have heard of young infants who inexplicably are found dead in their cribs, and they realize that this serotonin system is actually off in some of those infants. Well, we know that the serotonin system is off in patients with multiple system atrophy, but we don't fully understand it. And we know that some patients with multiple system atrophy are found deceased peacefully in their sleep, apparently. What's happening there? Is there a connection? Is it something about the regulation of the breathing? We're studying that. 2 patients with Parkinson's disease here. This is a serotonin scan. On the left is a patient without fatigue. On the right is a patient with fatigue. Same disease. The person on the left has a lot of serotonin. The person on the right, the serotonin has faded away. So we try to understand using scans like this, does this chemical have to do with the symptom? If so, does this help us develop a treatment? Should we be treating some symptom like fatigue with drugs that attack the serotonin system? Acetylcholine is another brain chemical that goes all around the brain and helps with thinking and memory. Look at patients with multiple system atrophy, and by and large, thinking and memory is really not a problem. We want to take a picture of the acetylcholine system. And we want to take a look in MSA. We've got plenty of pictures in people with Parkinson's disease or Alzheimer's disease. We don't have enough with MSA to understand this system. We're doing this. So really the big picture of what we're doing is learning more about the sequence of early loss of nerves and trying to better understand how that correlates with symptoms that patients are experiencing, and ultimately lead to better treatments and better targets. The systems that we're looking at are also important in other things that we're not sure are a big problem or not, or underappreciated, especially things like mood or cognition. So we are looking for multiple system atrophy patients who have had a diagnosis within the past 4 years. And there are other factors beyond that that decide whether somebody may or may not be eligible, for example, their medications. But that's something that we can look into if you are interested. Ultimately, we hope to get about 50 subjects scanned, because that would give us a wealth of information to put together. And it's not just one person's scan, it's seeing patterns across different patients who have had different kinds of symptoms. As part of our research in a rare disease, we know it's hard for us to just gather patients from Southeast Michigan. We want to help people come to Southeast Michigan, and we want to help with things like expenses, like travel and accommodations. The research, the data gathering here involves 3 days in Ann Arbor, several scans, MRI scan as well, physical and neurologic examination, different surveys asking you about symptoms, and then different physical tests such as finger tap and balance, testing memory. There were some questions about vision. We're going to be looking at that as well because we want to understand. We're not really sure what happens to vision in MSA. We may as well look. And even things like sense of smell. This is one of our research sites there at Domino's Farms in Ann Arbor. This is our PET suite. We have specialized balance testing where we have patients stand in a harness. It's not possible for them to fall. And we determine how they adjust if the platform shifts a little bit and how they keep their balance. So we're able to measure how good their balance is. We look at finger speed. How fast can you tap the pegboard in response to certain cues? And what does that tell us about the nervous system in your particular case? So there's a lot of things we do, but it's a lot of data from every patient, and it all adds up. You know, if you do participate in this study, Ann Arbor's a nice town. You're allowed to have fun. We've got a beautiful campus. There's the world-famous Zingerman's Deli. Ann Arbor is a great restaurant town, and it's a small town, easy to get around. So you can do some sightseeing. Staying active, as you've heard, is a really important part of the disease. And other things you can do to stay active while you're with us, or you can go to the Henry Ford Museum, Greenfield Village. You can look at the Wright Brothers Cyclery Shop, and that's been transplanted there. And the largest steam locomotives ever built, the Alleghenies. Look at this person. There's a lot to see. If you're interested, we left some flyers around on tables. Feel free to pick them up. Even if you're not sure you might qualify or not, we encourage you to give us a call. Arijit Bhaumik is with me today, and his email address is here, and his phone number is there as well, and it's on the flyers as well. I'll conclude by just saying a couple other things. The first is, are you familiar with the clinicaltrials.gov website? Those of you who are not, clinicaltrials.gov, all one word, is a place where you can just type in multiple system atrophy and you can come up with a list of all sorts of research being done, whether it's a treatment trial or whether it's an intel gathering study on this disease. I think that's all I have to say. I really thank you all for your attention, and it's really been a privilege being here.
One question that comes up a lot, do you give patients their own results if they want them?
That's a great question. So yes, we do give patients, if people are interested in, well, what did my scans show about me in particular, we can go over that and discuss that. That's correct. We can look at things like balance studies, neuropsych testing, and we can go over those. Some of the testing we do, we're not really sure in any individual case what it means necessarily, because we're still investigating that test for the MSA population. And it's once we gather more information, then it might become even more clear after we've assessed a number of patients, you know, what your particular scan results really mean.
Is there any cost to the patient?
There is. We do our best to cost to the patient. We do our best to defray travel and accommodation related expenses. And our goal is to not have patients turned away simply because they can't afford to come and see us. And there's also a honorarium provided for patients who can make it. So we hope that there is no significant cost to the patient.
That's what she's asking. There's no charge for any tests, right?
That's right. There's no cost. This is all, the tests are all, nothing is charged to your insurance, or you're not charged for any of these tests. I should also add that our study is funded by the National Institutes of Health. So we have, there's a lot of government dollars being put into research, and ours is one small slice of that. The other thing I want to add, which reminds me about that point, is we think about MSA, and boy, we need more MSA research and more MSA, and yeah, absolutely. But keep in mind that related brain and nervous system disorders like Parkinson's disease or even Lou Gehrig's, everything we learn from even nearby diseases in their trials could be something that helps us. So if there is a big trial underway in Parkinson's or Lou Gehrig's or stem cells, some other disease, we watch that with interest too, because ultimately that can help us.
Thank you.
So, thank you.